Hi folks, thank you so much for joining us here at Banner Health. I'm your host, Chris Coraggio. Our discussion today sort of on the serious nature, obviously sexually transmitted diseases, sexually transmitted infections, STDs, STIs, and we have a great panel to discuss this here today. A couple of gynecologists, Dr. Lindsay Allen, Dr. Pooja Shah. Thank you so much, both of you, for being here.
Thank you for having us.
We appreciate it. Okay, let's start. Again, those acronyms, STD, STI. Everyone sort of knows the STDs. But the infections, STI, is it the same thing?
It's a really good question. And honestly, what I would tell patients and anyone asking me about that is really that it doesn't make a big difference how you refer to it, because it's all caused by the same bacterial or viral infections that we're worried about here that are transmitted by sexual contact. It's just a matter of how recent was the infection. So if it was a recent infection, we kind of say STI. If it was something that's been more chronic or long-term and potentially has more consequences in their health to a patient, we might refer to it as an STD because it's more of a long-term illness that they're still dealing with. I
see. And what are the most common ones?
So there's probably three most common infections that we think about. Chlamydia is number one, gonorrhea is second, and then syphilis is actually rising across the country. So most often when we're screening patients know very commonly that we can screen for gonorrhea and chlamydia, but they might not know about all of the other ones that we can test for.
And that's pretty much the main reason why we're having this discussion, because in recent years, STDs are on the rise across the country, but especially here in Arizona, in recent years and really since the millennium. Why is that? What is the deal with here in our state?
Well, I'm not sure we understand all the factors, but I think just in general speaking terms, I mean, it may be a combination of that people in general are just more open and have potentially more sexual partners in a lifetime. I mean, that could be a part of the factor. And just that, these things tend to be asymptomatic. And so a lot of people may not even realize they carry something, and then it's getting spread, before we get a chance to intervene. And so I think maybe the combination of those two things could be contributing to increases that we're seeing across the nation and also here in Arizona.
Yep, and a lot of factors
right.
have to come into play for that statistic to rise. So
right.
That's why we're here. We're trying to get that information out, but we're also trying to get the information to folks about getting tested. Because you said sometimes there can be no symptoms whatsoever. Right? I guess that's a good thing, but that's a bad thing, right, Dr. Shah?
And as gynecologists, when we see patients for well women exams, we always talk about STD screening. So we always offer our patients screening for infections common like gonorrhea and chlamydia. But patients may not think about it, or they may not think that they need testing because they're not having any symptoms. And so that's really our opportunity to educate patients that we can have these types of infections without having any symptoms. We don't need to have vaginal discharge. We don't need to have pain. We don't need to have lesions that are visible in order to actually be affected by an infection. We do have certain age categories that we recommend screening for on a regular basis. So our younger age population, 15 to 24, we recommend that we screen them annually, not only for gonorrhea and chlamydia, but for other types of infections that we can screen through the blood, like HIV, syphilis, and common ones like that. And then really beyond that, it's assessing risk factors based on their history. So how many partners do they have? When was the last time they got screened? In pregnancy, that's an opportune time to screen for infections. And so we do that across the board. And oftentimes we're picking up things that patients never knew that they were exposed to in the past.
How do you guys deal with starting those conversations with your patients in just a checkup? Because I would imagine, and I think everyone would agree, that this could get awkward, right? But you guys do it every single day. So how do you kind of diffuse that situation?
Yeah, that's a great question. I mean, just having a conversation, the whole exam and coming to a gynecologist is a little bit awkward in general for most patients. And so just letting the patient know that we want to be open and honest, we want to help them. I just ask them, any new sexual partners, any concern for STD infections, STI infections when I'm seeing them in the office for their visit. And then explaining why I'm asking that. I want to offer you the testing. It's not because I have a suspicion. It's because, we want to make sure and be preventative and proactive about checking for those.
And we ask some pretty intimate questions,
Yeah.
right? Like, how many sexual partners have you had in the last year? How many sexual partners have you had in your lifetime? And it's not because we're trying to probe into your life.
Right.
It's really about trying to assess the risk factors, because we might recognize something as a risk factor that our patient didn't even realize was a problem.
Absolutely.
And you guys mentioned the age group that is most impacted maybe by this recent rise, if you will. But what about the older population? Are we seeing it become more prevalent in the older, say, 50 and above? I'm not sure.
Yeah, I mean, I think there is a concern about that group. Again, just with potentially having new partners recently, anybody who's had a new sexual partner should consider getting tested.
Doesn't matter the age.
Regardless of age,
Yeah.
absolutely. And it's again something we want to make somebody feel comfortable with. Don't be embarrassed. This is something that we really just want to help with and get addressed immediately. But yeah, older age population, it's definitely possible they can get exposed, with new sexual partners, which can happen. And so, but I think in general, just asking for the screening from a patient's perspective too, is something that we want them to feel comfortable with. But when we see patients every day, we're going to be bringing these things up regardless of their age.
And I think because it can be so embarrassing for them to talk about, I really make it a point to say, well, I'm here for you, right? Regardless of what you've had going on in your life, I'm here to help protect you and to take care of you. So try to be open and honest. And I think that really helps them feel at ease. One of the things that the CDC website has kind of outlined for the elderly patient population is that they can be more at risk, or we see this rise in STIs in that population because they're not worried about pregnancy, so they don't think about condom use. They have potential issues that our patients on the female side are maybe using hormone replacement therapy because of some of the symptoms that they're having based on menopause, but that helps them with their sexual drive. And then on the flip side, on the male side, they're using maybe certain medications that also help them with sexual drive. And so those patients might not be sharing very openly with their primary care provider about new partners or who they're seeing. They're not using condoms consistently, which is the same problem in our younger age population. And so that all of those contribute to the rise in the STDs.
And because of all of what you guys have laid out here, I guess what we want to get across to folks is, okay, it can be a little bit awkward to bring it up, but you guys are there for them, like you said, and it maybe as soon as that discussion has started, it gets less awkward, okay? That's one. But two, people might think, well, okay, it's awkward, I can get through that, but I don't want to go through all this screening and all this, but isn't it just a blood test?
Yeah,
Most times, right?
Yeah, most times we can do everything through a simple blood or urine test. I mean, you don't even necessarily need a pelvic examination. So that really helps a lot of our younger patients too, who haven't necessarily started routine gynecologic type of examinations. So I think that can be a way to ease fears about, I don't want to get anything swabbed anywhere. That sounds awkward and uncomfortable. But we can absolutely test without necessarily having to do an invasive exam. So it's very easy.
I think that's good for male partners to know too, right?
Absolutely.
I mean, we don't treat the male side, but men need to get tested as well, and we don't see that in our practice, but I don't know if men are asking for it as regularly from their primary care docs because they don't have a gynecology equivalent that they're seeing on an annual basis to have these really intimate type conversations. But that testing can be done in the urine or in the blood, depending on what it is that we're testing for, both for females and for males.
Yeah, and I would think that might be a problem for the male population because you're right. We don't have, there's a lot of talk about prostate and that, but it's not, maybe that discussion should kind of be in the open for a gentleman going to his primary care physician, hopefully once a year. You're doing that at least once a year, right? And just open that discussion up and just add that to the blood test, right?
Yeah, absolutely. I mean, it's easy to do.
It's easy to do. That's what I think people really just need to understand. What about HPV and HIV? Okay, let's talk a little bit about those two, as opposed to the most common STDs.
Right.
Are we seeing a rise there, and what kind of screening and treatment do we do? Especially with HIV, I know the advancements in decades, right? It's been paramount.
Yeah.
Yeah, absolutely. I mean, I guess the main difference to consider here is that we're talking about viral infections that can be with a person for their lifetime, in regards to HIV infection, where as opposed to what we've been discussing so far is something easily treated more with just an antibiotic and you're clear and you're free and you move on. Mm-hmm. So HIV has a lot more consequences, but the good news is that with advances, we have great treatment that can basically, keep that person healthy for their entire life. Mm-hmm. So it's really, really great. But getting HIV testing is still important. It's still out there, and it should just be with the blood work. Don't hesitate, ask for that as well, and we'll get patients screened for that routinely.
And the HPV, I know when folks heard we were doing this segment, there were some questions that were provided to the folks here at Banner. Mm-hmm. And I know one of them was, for HPV, is it true that everyone's to a point has that, it just doesn't become apparent? Is that accurate?
So HPV is short for human papillomavirus. Mm-hmm. So it's a virus, just like Lindsay said. And so we can get exposed at any point in our lifetime through sexual contact. And again, it doesn't have symptoms for most people. HPV has two big strains of infections. One can result in genital warts, so that is symptomatic. People can see that they have that, and then they get treated according to what their symptoms are. The other type of HPV doesn't have any symptoms at all, and that's the one that's related to cervical cancer or penile cancer or throat cancer. And that in women, we test for routinely through the pap smear. So we're ordering a specific extra test through their pap smear collection.
If they ask or if they do not ask, it's just?
Based on our guidelines on age. Mm-hmm.
Okay.
Yep. And so HPV testing for that high risk type of HPV that can then down the road lead to cervical cancer, increase the risk of cervical cancer, are tested routinely on the pap smear collection for women, but no symptoms, no discharge, no pain, nothing at all.
HPV you're talking about?
HPV,
here.
Yep.
Okay. So another reason for men, there's nothing that's being tested unless we ask. Is that correct? Okay.
Yeah.
Just again, that needs to be reminded.
HPV has a great vaccine, though, that's out there that we should really be promoting for all patients, whether male or female. So it's the HPV vaccine. That's how we kind of commonly think about it. And it helps protect people against multiple strains of HPV, both strains that lead to genital warts as well as those that lead to cancer. We recommend it now actually at the pediatric age. So our pediatricians are doing that for their patients.
For some time now, I think, right?
Yeah, for years. And we can do that then for patients who are into their 40s.
And is that, I was going to ask you, is that just a one-time vaccination?
It's a 3-vaccine series.
Oh, it is a series, okay. And how does that series run then?
Just over 6 months.
6 months.
So
okay,
3 injections over a 6 month
And then you're pretty much good.
Then you're good. Yep, and you're vaccinated.
Got it. We keep hearing this from the two of you here during this discussion about most of these are asymptomatic, no symptoms. But you did mention if someone does have symptoms, what are you said warts, right? So if someone is experiencing something that they think, oh boy, this might be right, what could those be?
That's a great question. So warts, absolutely, HPV related there. But other symptoms of STDs actually would be vaginal discharge, potentially penile discharge, discomfort, pelvic pain, and sometimes if the infection has progressed and been present for a long period of time, we actually worry about an infection called PID, stands for pelvic inflammatory disease. And so that's really where these can become way more problematic for a person's health. So it's not just a simple infection that's easily treated necessarily at that point. It's kind of that the bacteria that cause these, they ascend into the genital tract and actually can come up into the uterus fallopian tubes and really cause damage. And ultimately, in the big picture of things, we care a lot about these infections because we don't want to cause damage to those organs that can cause infertility later in life and have major consequences. So those would be, some of the symptoms to watch for: pain, discharge, fever, things like that.
And that could be anything, but it's important to bring that up in your yearly, right? Your annual
Right. Any
appointment.
any new symptom they may be feeling that's
Sure.
out of the ordinary, and also just getting anything like that checked out right away, even if it's not your time for your annual.
Yeah.
I mean, you could have felt fine 2 months ago, but if something has changed, come right in. We'll get it checked out for you.
What about herpes? Let's talk about some maybe misdiagnosis or a rise in herpes. What is there anything recently that you guys have encountered with patients?
So I think herpes falls into that kind of tricky category of
It's a little tricky.
viruses,
Right.
Yes.
just like HIV and HPV.
It can kind of just lay dormant and just, right?
So it can,
Yeah.
The symptoms that we see with herpes would be lesions, so painful ulcerated lesions, but they're not always easily diagnosed. So we can do a swab of the actual ulcer to send it off for viral testing.
I see.
But some people ask to get blood work done, and with herpes, we can do blood work to see if there's been a recent infection or if there was exposure a long time ago. Right. And I think that's really where it becomes tricky, is if the blood work comes back positive saying that you were exposed years ago, but you've never had any symptoms, patients start to get very worried about that diagnosis. And then it becomes a much larger conversation that we have to have and help patients understand that, yes, you could have been exposed a long time ago and never have been symptomatic. And that doesn't necessarily warrant treatment.
I was going to ask you, then what do you do? I mean, you don't, obviously the patient's going to worry, but it
Right.
may never present itself in any fashion?
It's very possible, right? So I kind of try to take the approach of reassurance. If they haven't had symptoms to that point, even though the blood work shows they may have had exposure, it's very possible they go on and have no symptoms ongoing through their life. But we really just educate them at that point about, okay, here's what to look for. This would be the treatment if there are symptoms that arise. And just, let us know. We can always reevaluate if symptoms do occur. So I think just educational piece on what the blood tests actually mean, because it's not clear-cut positive or negative just based on a blood test that we do for genital herpes. It's more about looking for the actual lesion, the ulceration that can come up in the genital area.
So with herpes, there's always a symptom, or can that be asymptomatic in certain cases as well?
Right. Again, it can lay dormant. So in those phases, patients, still have the virus inside them, but it's not necessarily presenting.
Sure.
Right.
So overall, what we're trying to get across again is the screening portion. Now, have you guys, as long as you've been practicing, like you said, is it instructed maybe to elicit discussions about getting screened to each one of your patients, maybe more than 10 years ago? Have you experienced that?
Yeah, I think
Just
that
start that discussion, because
Right.
obviously if things are on the rise, we got to cut it off at some point.
Absolutely. I think just, again, multifactorial, but just making the patient feel comfortable is the number one thing. There's no need to be embarrassed. Come in, we're going to have a discussion about this, and this is a discussion we're going to have with every single patient. We're not singling you out. We want to help. We want to prevent worsening of potential infections, damage to their health long term, and so it's really coming from that place of just preventative medicine and trying to help somebody be safe.
And we love educating. So
Right.
a lot of it that we've talked about today is really helping our patients understand what could it be and why are we doing this and why are we worried, or what can we do to just screen you regularly. And maybe they're not interested in doing it at that first discussion.
I was going to
But
ask
then they
about
come
that.
back and they see us.
Do you guys see that where, okay, it's an educational kind of discussion maybe you're in their yearly exam, and then you encourage, okay, if you're not going to do the screening today, maybe before next year, maybe we come in and we cut this off at 3 months and you come back and you just do the screening. Does that happen where they can kind of think about it and realize, okay, it's not that big of a deal?
Or they make an appointment to ask us to do the testing for them.
Oh, I see. Is that a form of procrastination? I don't know, but at least the discussion, you're moving. Okay, the ball is moving, right?
Yeah, and I tell patients, okay, when you're ready, we'll do it, and every year, think about doing it again. Make sure you have your negative results, and then you move on, and you don't have nothing to worry about. So just make that a habit of yours to advocate for yourself. Even if you were negative last year or 2 years ago, think about it again. Do you need the screening? We can absolutely do it. We've talked about it. It's easy. We should do it. So.
And in your experience, both of you, have you seen more and more patients be willing to step up and get this taken care of, maybe opposed to years back?
I think so.
Yeah,
Yeah.
and that's the
I would
goal,
say
right?
so.
That's what we're
Yeah.
trying to do,
Right.
right? Trying to educate and get people to just kind of step forward and realize the screening is so vital.
Absolutely.
And I think there's a lot of good resources out there too, right? So we're just one resource to be
Yeah.
able to have a face-to-face conversation with a patient, but there's a lot of other kind of printed resources that we can point the patient in that direction so that they can start doing some of that reading on their own as well.
And Dr. Shaw, you must have some broadcasting in your background, because that is a perfect segue to what I was about to say, because a resource is Find a Doctor on bannerhealth.com. You can go to that website right there and get a lot of information, many of which we discussed here today. Right?
Absolutely.
Dr. Allen, Dr. Shaw, thank you so much. Very educational, very, very important.
Thank you so much for having us.
It was
Happy to help.
fantastic. Thank you.
You got it. Folks, we'll see you next time.